Good afternoon. Welcome to the next section on connected healthcare. For the next 20 minutes, I will talk about a very interesting topic, patient training. And this will come out as a new wellcare model for all of us. I'm Virginia Chan, Head of Digitalization ASEAN at Siemens Healthineers. Welcome to connect with me on LinkedIn. So first, we will talk about what is patient training and how can you create a digital twin of yourself with the nationwide health information exchange platform. And then with those data, how can AI applications support us in diagnostic, clinical pathway, robotic surgery, but also remote monitoring. So let's take a look. As our heart is beating, this is the patient training. It's a personalization of diagnostic therapeutic selection and also with monitoring aftercare to manage our health. It is a very holistic view and with closed loop feedback with all your data, not only for now, but also all your longitudinal data along your life cycle. And essentially, we will be able to connect your lifestyle data with wearable, your laboratory and genome data, together with the imaging data. Everything will be on your fingertips. And here we will finally be able to do preventive, predictive, precision and participating healthcare with AI supported. So in order to create your patient training, first we need to have a smart healthcare ecosystem. And this nationwide interoperability is very important so that you can connect the data from hospital to home. And this ultimately improves our quality and access of care. This is one example of our healthcare digitalization ecosystem. Essentially, we are moving from the traditional healthcare to wellcare. And we can integrate the different hospital, clinic, specialists, together with the community at your home, and also connect with the e-pharmacy and insurance company so that we have a seamless care cycle. But most important, with 5G coming to our region, we are able to improve the access of care with remote screening and remote surgery. That's really exciting time. And on top of those data, we will be able to create an AI-driven automated workflow engine where we can connect with eHealth. So we can connect you with all the caregivers and also with AI to support the physician on diagnostic and also therapeutic decision-making. But also important for any of our hospital management team that they can optimize the operation management with AI. For example, during COVID, we were able to use our AI engine to predict the COVID bed capacity and also the PPE materials and supply in the logistics. So this is very important and new era that we can create with the smart hospital ecosystem. And on top of that, you see here the 5G enable a remote control ambulance that can really provide the speed and quality of care anywhere. In summary, it's very important to create our digital twin. First, we need to aggregate the data. And then secondly, with our digital health IoT platform, we are able to build a lot of application on top of it, be it is the patient engagement and also the AI diagnostic. Here we have example that we've been connected to over 60 countries with more than 6,000 hospital institutions. And this is really a powerful tool that we can own our one moment of truth of our healthcare data. And for example, we have already done this in over 25 countries, that it doesn't matter you have a laboratory data in one laboratory, clinics or hospital, we are able to aggregate all the data together. So it's a portable data for you as a person anytime that you can access with your own healthcare data. And with that, there are lots of possibility for us to utilize this digital trained data of you. For example, we can have a mobile app where you can have access and also virtual visit with the clinicians. You can have the patient portal to see any of our data anytime. And also very important, we have the physician portal where the multidisciplinary team can share the data and talk to each other virtually while discussing the different cases. Instead of running into different specialists, you are the center of the universe as the patient, and you can also get access to the data with the care team. So one example that we've been able to expand the reach of scan services is what we call a remote scan as a service model with our virtual cockpit. For example, this is the beautiful islands of Okinawa, and they have limited number of radiologists that can take care of the scan. And here we are able to place 8 MRI while using the virtual cockpit with a senior technologist to monitor the scanning of all the different islands patients. At the same time, we also work with recently the stroke international service in Vietnam with our digitalization and the virtual cockpit, where we can enable 20 million of people to access the stroke treatment. So this is a very powerful technology to improve access of care. And in healthcare, time is life. And time is also the quality of life. So here we are able to use the eHealth platform to connect with the remote ambulance. Before we arrive to the hospital, we already can do pre-hospital diagnostic. So once the stroke patient get inside the hospital, the decision is already made on what kind of treatment concept. So this totally speed up our care and treatment delivery and improve the survival, but also the quality of life of our patients. With this hub and spoke model. And one example we have done in China is also with a 5G remote scanning assistant during COVID. And then we are able to speed up our care delivery with this remote setup. And we have been seeing a lot more now with this like a remote truck in Japan and also in other countries, and it really improved our access of care. So once we aggregate all the data with the different screening and testing, how do we do with this data so that you as a patient and or your family member will have a much better care? And this is really all about how do we improve the quality, despite that in this part of the world, we have 600 million people in Southeast Asia, but we certainly have a shortage of manpower in terms of our healthcare professional. So here, AI play a very key role to support diagnostic clinical decision-making. At Siemens Healthineers, every hour, we can access 100 million images, and also with clinical and genome data. And every hour, we are touching upon 200,000 patients. And this really enable us to explore using the AI technology for precision therapy. This is our innovation priority. And every day, we've been running 1,000 AI experiments with 700 machine learning. So this is now really our core of breakthrough innovation. Together with Varian, we will be looking into the digitalization along the treatment pathway. And like what we said, now I want to bring you to a journey. How do we as a patient can utilize AI from the first stage of prevention and early detection, and then with the diagnostic, then we look into what kind of therapy and monitoring we can take together with the follow-up post-treatment. And we, after our integration, acquisition of Varian, we are very focused on the biggest problem in the world, which are the cancer, stroke, cardiovascular, and infectious disease with orthopedic. And apart from the medical technology, it's also very important that we offer the digitalization and also consulting services. So let's start our patient journey with our patient training. So we look into first, when we go into a diagnostic, oftentimes imaging play a very key role. And we have the AI radiology companion, which can seamlessly integrate to the workflow of our healthcare institutions. And for example, here the AI is empower our physician to make the decision and also automate the reporting and the measurement of the radiology report. Historically, maybe a report will take 20 minutes. With the AI technology, we are able to shorten it to 2 minutes. And this will improve our quality of care, but also with a better precision in our diagnostic. For example, we've been working with radiology across border to have the breast cancer screening available in Hanoi, in Vietnam, in a massive scale because of the AI technology. Apart from that, we also have the brain MR, the chest CT, and the chest X-ray and organs RT and prostate MR for different cancer and diagnostic. During COVID time, of course, the chest CT are very important. We are able to use the AI algorithm to enable very precise diagnosis and also to relieve the workload of our healthcare professional to have a much better detection of COVID using the AI technology on chest CT. And apart from that, for cancer, the most important part is early detection. Early detection will reduce costs and benefits much better for the quality of life for the patient. With the AI-enabled technology, we will be able to detect the coronary calcium, which is a great indicator of a lung cancer. So this is really a powerful tool that we can use across the different therapeutic journey. And apart from that, training the healthcare professional is often a very expensive and challenging task. Using our real-time cinematic rendering, we actually can virtually see the different part of the patient with the patient training. Is excellent tools for education and training, also improve the communication with the patient and our referral network. But most important, as the surgeon able to see it very clearly, we will be able to have a more precise surgical strategy. So as we move forward, after the diagnostics, we will need to go into what are the treatment pathway we can take. And AI here, we have an AI pathway where we can connect the patient data, the therapeutic data, the laboratory, and also the genome data and imaging data. We can structure this a lot of data together to present a logical pathway, clinical pathway for the physician. And this is a very holistic approach for with patient training, and also is a very intelligent model using NLP. Here with also the cohort model. Currently, we have already this available for prostate cancer, lung cancer, and then we are also working on breast cancer and coronary artery disease with the analytics KPIs using AI. So we see the future that AI really empower patient, but also the physician to have much better treatment outcome. And after the diagnostic, you will think about how can AI help the physician or the surgeon to navigate the workflow and really come out with the therapy delivery. It's like driving the autonomous car. And here we using the AI to empower the physician and also eliminate trial and error and build in all the encyclopedias to support the physician. And for example, today we have an open loop algorithm and to targeted automations. However, tomorrow we will be able to do a closed loop image guided autonomous navigation for this surgery for stroke treatment. So it is a very powerful tool. We can go automatic surgical path. However, the control is still on the driver, is still on the surgeon. But here we can provide automatic navigation for him or her to go through the treatment very effectively. And on top of that, with the very ultra low latency of 5G, we are also able to provide remote robotic surgery. And oftentimes, a lot of surgeries are not able to be done because the lack of the qualified physician. And here, with the robotic remote surgery, we will be able to have a timely access of care, but also expand the number of patients we can treat globally. So this is a very exciting time. One example is during COVID, we were able to do a remote interventional procedure supported by our robotic solution. And so the physician need not to be in the surgical room and can conduct the surgery remotely. So after the surgery, the patient will come home. How can the remote monitoring support his recovery and reduce the readmission? This is one example in Germany with Heart Connect from our Heart and Diabetes Center. And here, after the surgery, the patient go home, he received the devices for ECG and blood pressure and also the weight. And then he has the mobile apps. And together we have the nurses who continuously monitor this patient and do coaching to him to improve his lifestyle and really support him to changing the habits so that he can keep healthy and improve the quality of life. It also gives the caregiver in the family the visibility of the patient's post-treatment. And with the AI tools, we will be able to support the staff to prioritize and orchestrate the workflow and have some alert in case something happened to the patient. So this is really the power of digital twin and having the patient training. So going through the whole process from diagnostic, therapeutic, surgical, but also post-treatment monitoring and the home care. So these are the great summary of the patient training. So as a community, if you would like to enable patient training, what we can do together is an industry partnership. We will be able to bring the technology, experience, the knowledge, and also resources. Very important, in order to get our own data as a patient training, we need to have the digital, legal, and architecture standard. And second, we need to collaborate to really expand our AI portfolio with patent and so that we can do next generation decision making. But most important, the patient need to find that this is useful. This is really improve their quality of life with the interoperable secure information flow so that we can integrate the care from hospital to home. And finally, from government or a private hospital group, we need to build a robust organization and financial offering with the public-private partnership so that we can overall collectively improve our care delivery. And also, very important, we need to educate the team so that we have a learning digital health system coming together as a community. So with this sharing, I would like to call upon all of you that we can work together to pioneer breakthrough in healthcare for everyone, everywhere. It's very important that we can expand a very personalized precision medicine, transform the care delivery for any part of the world, and improve the patient experience with digitizing healthcare. Looking forward to build every one of you your patient training together. And thank you once again for joining us today. Thank you.